Foot and mouth disease is the most feared of all animal diseases, but paradoxically, it is not one that kills animals on a large scale. Its effects are economic. This is often poorly understood, and one of the major objectives of the next few minutes is to explain why foot and mouth disease is so economically important. The disease can occur in all cloven-hoofed or so-called even-toed animals, such as cattle, goats, sheep, pigs, deer, antelope, and also camels, but not in odd-toed animals, such as horses or rhinos. People do not develop foot and mouth disease. For indigenous African livestock, like these Nguni cattle, for instance, foot and mouth disease is a relatively mild disease, although it may affect milk production in cows and interfere with ploughing at critical times of the year. Typically, it causes vesicles or blisters in the mouth and at the skin-hoof junction. These soon rupture, leaving raw and painful lesions, which makes eating difficult and may cause lameness. However, these animals generally recover within a week or two. Among domestic animals, cattle and pigs are worst affected by foot and mouth disease. Sheep, and particularly goats, tend to develop mild disease, and the infection in goats in southern Africa is not usually apparent. African buffalo rarely, if ever, develop the disease. This is despite the fact that most buffalo populations in southern and East Africa are infected with SAT-type viruses at an early age. Antelope appear to vary in their susceptibility. Some, such as impala and kudu, developing pronounced lesions on occasion, particularly of the feet. Other species, such as blue wildebeest, seem to become diseased relatively infrequently. The question is therefore, why is foot and mouth disease so feared if it is generally a relatively mild condition? The major reason is that, under high input and intensive husbandry systems, it is impossible to farm economically in the face of foot and mouth disease, because the disease can be very severe in high-producing animals. It results in rapid reduction in milk and meat production, although, as already mentioned, in extensive farming systems, the disease is less severe. This is why developed regions of the world have spent many years and huge sums of money in eradicating the disease. They will therefore go to great lengths not to re-import it. This leads effectively to trade embargoes on agricultural products derived from regions or countries which do not control the disease effectively. The result is that African countries do not generally have access to the lucrative produce markets of the developed world, such as North America, Western Europe, and the Pacific Rim. There are three main factors that contribute to foot and mouth disease being such a feared disease in agriculturally advanced countries. Firstly, the disease is more contagious than any other infection of mammals and can spread rapidly over large tracts of countryside and infect many animals in a short space of time. A good example of this occurred in Zimbabwe in 1989, when the disease was spread widely following a cattle sale. Secondly, there are 7 different types of foot and mouth disease virus, and each type has variants, referred to as subtypes, which means that soon after recovery from infection with one virus, susceptible animals may again become infected with another. So the infection not only spreads quickly and widely, but farmers are faced with repeated outbreaks unless the disease is adequately controlled. In the third place, particularly under intensive systems, for example feedlots, dairies and piggeries, the systemic disease and pain resulting from lesions in the mouth and on the feet result in weight loss, a drop in milk production, and general debility. In dairy cattle in particular, mastitis, which is frequently an important part of the disease, may have severe and long-lasting consequences, and cows may lose 1 or more quarters permanently. Foot and mouth disease is transmitted mostly by direct contact between diseased and susceptible animals. Occasionally, it is transmitted indirectly by animal products that contain the virus, such as milk and meat. Contaminated vehicles used to transport infected animals and then used to convey susceptible animals without being decontaminated may also result in disease transmission. Even people whose hands, shoes and clothing are contaminated by the virus may inadvertently transmit foot and mouth disease. In Europe, airborne transmission of foot and mouth disease has been found to occur over distances of up to about 10 kilometers over land and much further across water surfaces. However, for this to occur, specific climatic and epidemiological conditions must prevail, which fortunately are uncommon in Africa. Most important among these is that for foot and mouth disease virus to survive in aerosols, the relative humidity of the air must exceed 60%. Secondly, there must be an intense source of virus for airborne transmission to occur. Usually, this is provided by high concentrations of infected pigs, because individual pigs excrete up to 3,000 times more virus in aerosols than do cattle. The third requirement for airborne transmission is a high stocking rate among the recipient animals, usually cattle, because of their large inspiratory volume. In sub-Saharan Africa, with its generally dry climate, small numbers of pigs, and very low stocking rates, airborne transmission appears to occur rarely at most. In Africa, there are two other features of foot and mouth disease which distinguish it from the disease in other parts of the world. 1. The 3 SAT types of foot and mouth disease virus are endemic to sub-Saharan Africa and essentially occur nowhere else. SAT is an acronym for South African Territories, which was the name used for the viruses when they were first described nearly 50 years ago. This group differs from the group which comprises the other 4 types, namely types A, O, C, and ASHA1. Furthermore, there is more variation within each of the SAT types than within any other virus types. Second, unlike the situation elsewhere in the world, wildlife is a very important facet of the epidemiology of foot and mouth disease in sub-Saharan Africa, particularly in southern Africa. All available evidence indicates that in southern and some regions of Central Africa, buffalo play a crucial role and are largely responsible for maintaining the SAT-type viruses. The evidence from East Africa is less extensive and clear-cut, and it is probable that foot and mouth disease there, even that caused by the SAT virus types, is maintained largely by domestic livestock. A similar situation probably prevails in West Africa and the Sahel. The way in which buffalo maintain the SAT types of foot and mouth disease virus is not absolutely clear, but in the Kruger National Park in South Africa, for example, most become infected with all 3 SAT virus types within the first year of life, and probably soon after maternal immunity wanes between 2 and 6 months after birth. However, few, if any, of these infections result in disease. During the acute phase of infection, which lasts about a week, young buffalo are capable of excreting large amounts of virus and are therefore a source of infection for their cohorts, as well as other susceptible animal species with which they come in close contact. By 7 to 10 days after initial infection, foot and mouth disease virus disappears from all tissues and secretions, other than those of the pharyngeal area, where SAT-type viruses may persist in individual animals for 5 years or longer. Rarely, these persistently infected buffalo, commonly referred to as carriers, may infect other animals with which they come in contact, be they susceptible buffalo, other wild animals, or domestic livestock. So, as is the case for cattle, buffalo are able to maintain foot and mouth disease viruses without the involvement of any other species. Amongst African wildlife other than buffalo, development of carrier status has only been shown for kudu, but these animals do not appear to be important in the epidemiology of the disease in the region. Cattle, and to some extent other domestic ruminants, also become persistently infected with foot-and-mouth disease viruses. That is, they become carriers. In cattle, this does not usually last for more than 4 to 5 months, although in a small proportion of animals, the carrier state may persist for more than 3 years. In the SAT2 outbreaks, which afflicted Zimbabwe between 1983 and 1991, there is good evidence that carrier cattle precipitated at least 2 outbreaks more than 2 years after they themselves became infected. Carrier sheep and goats do not usually harbor foot-and-mouth disease viruses for more than 1 to 5 months, despite the finding that occasionally foot-and-mouth disease viruses persist in sheep and goats for up to a year. However, to date, no reliable instances of carrier sheep and goats having precipitated outbreaks of foot-and-mouth disease have been recorded in Africa. Pigs differ from ruminants in that they do not become carriers, and so are not infectious beyond the acute stage of infection, that is, no longer than 2 weeks. The control of foot-and-mouth disease in enzootic areas is based mostly on zoosanitary measures. These aim at minimizing the spread of infection from infected animals and their products to susceptible animals. Immunization, otherwise known as vaccination of susceptible animals, so that if they are exposed to infection with foot-and-mouth disease, they will not develop the disease, is the other major way in which the disease is controlled. However, before control measures can be implemented efficiently and effectively, it is vital that the presence, distribution, and extent of foot-and-mouth disease in the locality involved be determined and monitored. It is important to appreciate that without surveillance, effective control is impossible. In most enzootic regions in Africa, surveillance is based on regular physical inspection of cloven-hoofed animals, particularly cattle, because cattle are more susceptible to infection than other domestic animals. Surveillance may be instituted at places where potentially infected animals are gathered, such as dip tanks, sale pens, and abattoirs, because in that way relatively large numbers of animals can be inspected with minimal cost to and disturbance of agricultural communities. Because foot-and-mouth disease may be inapparent, especially in small stock, it is necessary to conduct serological surveillance to be sure foot-and-mouth disease is not present in areas close to endemic areas. Measures important in preventing the spread of foot-and-mouth disease from enzootic areas are restrictions on the movement of cloven-hoofed animals and insistence on a permit system, whereby cloven-hoofed animals are required to be inspected by an animal health official before they may be moved between properties. This ensures that should foot-and-mouth disease occur, the possible spread and date of infection can be determined and appropriate measures instituted. Furthermore, for movement of animals from high-risk districts to those known to be free of the disease, movement should be dependent upon quarantine of the animals to be moved in an official quarantine station, lasting at least 2 weeks. This is so that foot-and-mouth disease cannot be spread by animals in the incubation period of the disease, which does not exceed 13 days. In this context, it is important to remember that animals which develop foot-and-mouth disease may excrete the virus for 1 to 3 days before lesions of the disease become apparent. In southern Africa, particularly Botswana, Zimbabwe, and South Africa, both cattle and game fencing has been used to contain foot-and-mouth disease to enzootic areas and prevent its spread to areas in those countries free of the infection. This is possible because spread of the disease by air currents in Africa essentially does not occur. The advantage which game-proof fencing provides is that it also prevents wildlife, which otherwise cannot be controlled, from spreading the infection. For this reason, the use of fencing is a cornerstone of foot-and-mouth disease control in southern Africa, despite the fact that it has been severely criticized by conservationists on the grounds that such fences have sometimes disturbed wildlife migration routes and access to water. Controls on the movement of animal products, such as milk and meat, should also be applied to ensure that foot and mouth disease viruses are not disseminated in that way. In the case of beef, however, there is usually only a small quantity of virus in skeletal muscle derived from infected animals, and the fall in pH caused by the post-mortem breakdown of glycogen to lactic acid inactivates any that is present. Unfortunately, lymph nodes and bone marrow may contain high levels of foot and mouth disease virus. These tissues are not exposed to this change in pH, and therefore beef, which is not deboned and from which the lymph nodes have not been removed, can still contain considerable quantities of foot and mouth disease virus. Up to 1 million infectious doses of foot and mouth disease virus may occur in each milliliter of milk produced by infected cows, and milk is therefore a very important way in which the virus can be spread. Vaccination is vital for the control of foot and mouth disease in enzootic situations. However, if correctly formulated vaccine, that is, vaccine containing strains of virus appropriate to the locality where it is to be used, is not applied judiciously, it may complicate rather than aid the control of the disease. Modern foot and mouth disease vaccines are inactivated. That is, they contain large quantities of one or more of the foot and mouth disease virus types which have been treated with a chemical compound to prevent the virus from replicating. The inactivated virus is then mixed with an adjuvant to potentiate the immune response. Conventionally, the adjuvant consists of alhydrogel and saponin, but newer vaccines sometimes contain oil adjuvants which induce longer-lasting immune responses. This obviates the need for frequent revaccination. Vaccines that have oil adjuvants induce better immunity in pigs than does vaccine containing alhydrogel saponin. Ideally, foot and mouth disease vaccine adjuvanted with alhydrogel and saponin should be inoculated twice initially at a 4 to 8 week interval to cattle older than 6 months of age. Thereafter, the immunity of cattle should be boosted at least every 6 months. For sheep and goats, the same basic schedule should be followed, although the advisability of vaccinating small stock is something over which there are differences of opinion. In most southern African countries, this is not done, because it is believed that sheep and goats are not important in the epidemiology of foot and mouth disease. In North Africa, by contrast, where sheep and goats are clearly involved in maintaining the disease, vaccination of small stock is important. It is also essential that not only does the vaccine contain appropriate virus types for the locality where it is used, but also that it be demonstrated that the virus strains in the vaccine will be effective in that locality. SAT-type viruses differ between localities, and it may be that the viruses incorporated into the vaccine do not effectively protect against the viruses circulating in the field. It is also vital to ensure that vaccine is stored and used as recommended by the manufacturer. For example, it should not be frozen or exposed to temperatures over 10 degrees Celsius for more than a few hours. Measures that need to be implemented in the event of a foot and mouth disease outbreak are many and depend on where the outbreak occurs, its extent, and special circumstances that prevail. In general, however, there are two fundamental approaches. The first is so-called stamping out, where in the event of a localized outbreak, all the infected animals and those in direct contact with them are killed in situ, and the carcasses burnt or buried. This can only be done if the financial and logistical means are available. The exercise can be completed within a few days, and the owners of the animals adequately compensated. Stamping out is the ideal. An alternative is to quarantine the infected and in-contact animals within the infected area, which needs to be separated from surrounding livestock by 2 barriers, such as fences, as shown in the diagram. The area between the 2 barriers, or cordons as they are commonly referred to, should be maintained free of livestock. The animals within the infected area should be vaccinated against the appropriate virus type as soon as possible to ensure that all animals become immune within a short space of time. Likewise, the animals in the free area near to or adjacent to the stock-free area should also be placed under quarantine and vaccinated. It is essential that people working within the infected area have no contact with those handling animals in uninfected areas. Traditionally, these quarantine measures are maintained for 4 to 6 months after the last clinical case within the infected area. However, the recent finding in Zimbabwe that carrier cattle have initiated outbreaks at least 2 years after they became infected brings this policy into question. But at present, there are no guidelines as to how long quarantine should be maintained. For the laboratory confirmation of foot and mouth disease and typing and subtyping of the virus concerned, appropriate specimens need to be obtained while the outbreak is in its initial stages, that is, within about 2 weeks of clinical onset. The first step requires that animals with early lesions be identified. Ideally, specimens should be obtained from 2 to 4 animals. Recently ruptured vesicles, either in the mouth or on the feet, provide the best material, and tags of epithelial tissue at the edge of the vesicles should be collected and placed in buffered saline and kept on ice. If ice is not available, the tissue tags may be placed in a 50-50 mixture of buffered saline and glycerol, the idea being that the glycerol acts as a bacteriostat. In either event, the specimen should be delivered to a laboratory registered to handle foot and mouth disease virus within 24 hours. Whole blood for the preparation of serum should be collected from the animals from which epithelial tissue is collected, and at least 5 to 6 other animals in the herd. In cases where the acute stage of the infection has passed and ruminants are involved, probang specimens should be collected to identify the causative virus from persistently infected animals. In such circumstances, at least 10 animals should be sampled, because probang testing is not reliable for individual animals. It is important that the specimens are properly identified and packed, so that the specimen package itself is not a source of infection. 4% washing soda, that is, sodium carbonate, is an effective and cheap disinfectant. Of vital importance is that animal health workers involved with foot and mouth disease disinfect themselves, their equipment, and vehicles before leaving an infected farm. If this is not done, iatrogenic or man-made transmission of the disease is bound to occur. It is vital for the development of livestock industries in Africa that foot and mouth disease be effectively controlled and preferably eradicated. If this is not done, the continent's agricultural development will be stunted for the foreseeable future.